Good morning, everyone. Thank you so much for being here. I'm very proud to introduce my esteemed panel, JoAnn Stonier, who is the Chief Data Officer at Mastercard, Dr. Richard Carmona, the 17th Surgeon General of the United States, who's now the Chief of Health Innovations at Canyon Ranch, and Swati Abbott, who's the CEO of Blue Health Intelligence. Thank you all so much for being here. So, JoAnn, let's start with you.
Okay.
You know, we're in this time in which there's so many ascendant, emerging, in some cases dominant, if we're thinking about cloud computing these days, technologies. And I'm wondering how you guys at Mastercard are leveraging big data, both for yourselves and for your clients.
Sure. So I hope many of you used your Mastercard on your way here, whether you paid with a card in your wallet or something that looks closer to something like this. Over every year, we process over 74 billion transactions, and that data is used for generating insights in lots of different contexts. And so first I have to give you all a lesson in what Mastercard does, because there's oftentimes a very large misunderstanding about what my company does. So please do not come up to me at the break and ask me to fix your credit card bill. That would be your bank, and you should absolutely speak to them about any issues you have. Mastercard sits in between the banks, right? We operate a payment card network that processes those transactions, and then we use that data, we aggregate it usually, and we de-identify it in many cases, to actually provide different types of insights for our customers. Obviously, we also use it for fraud prevention. Many of you have gotten a message from your bank or from Mastercard when something doesn't look right. We use that information to consistently improve our safety and security of the network. It's one of the reasons that you use your Mastercard, because you trust us with your data. But then we also, within context, use our data because it's very powerful when you think about it from an economic perspective. So what data do we actually get? I think that's oftentimes also really important. I don't get your shopping basket data, but what data I do get includes the date, time, place of the transaction, which includes the merchant name, the merchant location, and the currency amount, both in local currency and in the conversion to US dollars. So why is that important? Well, over time, we get to see a picture of what's going on, not just with an individual, which can be interesting, but that's not what's most interesting to our customers, which are generally merchants, financial institutions, and governments. What's interesting is really about populations and the economy and the economic impact of that information. So we work oftentimes with a government or a merchant, for example, who wants to understand how a particular neighborhood or location is actually performing. What's the economic trend analysis, or how are different categories of spends connected? So for example, it's really interesting oftentimes to a series of merchants that on Saturdays, many of us do the same things in different neighborhoods. We start out our day perhaps at the gas station filling up our car. We then go to the grocery store. We then drop off our dry cleaning or do the laundry at a laundromat. And if merchants understand that, they can enter into partnerships with each other, right? So it's a contextual question that we can help answer. Or for a government, it's really important if they have an opportunity zone or some other area that they'd like to invest in their city. Well, where should I invest? What's the economic pattern of spend if I make an investment in a hospital or a university? And then what will happen to that area? What kind of spending does that generate over time? So our past information can be very powerful in predicting what kind of economic opportunity can be generated in a local area. Those are the types of analysis that my data is very useful with, oftentimes married with the data of an individual customer.
Mm-hmm. And Dr. Carmona, we know you as Surgeon General. Now you're at Canyon Ranch. Could you explain for those who don't know what that organization does and how you're leveraging new technology tools?
Happy to do so. Thanks so much for allowing me to be with you today. As many of you know, I'm a recovering surgeon. If you ask a surgeon to name the best 3 surgeons in the world, they always have trouble naming the other 2. And of course, that's where data comes in, because now we can identify who that best doctor is or best practices are. Canyon Ranch is a premier brand in health and wellness destination resorts, cruise ships, number of properties. and growing, but it's perfectly positioned now because its value proposition has always been the pursuit of optimal health and wellness. To do that, we need large data swats to be able to make those decisions that benefit our guests. It's a great time to be in this business of health and wellness because, as many of you know, the wellness industry is now estimated at about $4.4 trillion annually, globally. And we serve guests from all over the world. And so when we look at the demand, where it's coming from, as a nation, we're spending about 19% of our GDP on what we call health care. The fact is, it's not health care. At Canyon Ranch, we understand it's sick care because 75 to 80 cents of every dollar spent is spent on chronic diseases that we cause because we don't manage our lives well, we make bad decisions, and then we hope to see a provider that's going to bail us out of those problems, like hypertension, type 2 diabetes, hyperlipidemia. So the proximate cause of this rise in disease and economic burden is us and the bad decisions we make throughout a lifetime. At Canyon Ranch, our goal is to help you make that transition to start moving in the path of optimizing your health and wellness. In doing so, it reduces the cost of care, it improves the quality and quantity of life. Again, going back to the proximate cause of the disease and economic burden that continues to grow, the fact is it's us. Like Pogo said, we've met the enemy is us. And the challenge is, how do you take the most complex science in the world, translate it in a culturally competent, health literate manner, deliver it to an end user, a guest or a patient, to do one thing only: effect sustainable behavioral change that results in improved health outcomes. To do that, we need a lot of data to be able to make those decisions. We're the most heterogeneous, one of the most heterogeneous nations in the world, and so we have hundreds of dialects and languages and practices of buying and eating food and cooking food. And all of those things come into play because one size doesn't fit all. But with the data, we can stratify different demographics. We know how to address a 20-year-old versus an 80-year-old. We know if we're able to get enough data, which is what the experts here do for a living, to be able to ask the right questions, store that data so I will know potentially if I have your genomic information, and through nutrigenomics, pharmacogenomics, psychogenomics, all of those subsets, I can predict what your life is going to be. Far greater than in the last few years we would talk about, if I know your zip code, I can predict your outcomes. Well, that's still true, except there's a lot of gentrification occurring, and it's not going to be true for long. What is important, though, if I have your unique information, then I can be precise in what I prescribe for you. So that's where precision health and precision medicine is going. And I want to emphasize precision health because a lot of the talk we hear about is precision medicine. Equally important, but that's addressing the person that's sick. What if we harvest this information to keep you healthy and drive down the cost of care? And the challenge, of course, is we're in a perversely incentivized health system that rewards the provider to make you better when you get sick, and we don't have a business model yet that supports somebody keeping you healthy. That's what we do at Canyon Ranch. We support our practitioners to keep you healthy, and we use all of the data to put you on that path to optimizing health and wellness, and as I said, reducing the cost of care, improving the quality and quantity of life.
Mm-hmm. And Swati, speaking of predicting health outcomes, Blue Health Intelligence is at a really sort of key place in doing that. Could you explain to those who don't know, what you guys are focused on, and also how you're using big data and other new technologies to do that?
Absolutely, thank you. So at Blue Health Intelligence, there was, an understanding, as you all may know, there are 36 Blue Cross entities throughout the country. And they're very community-based because they want to understand, how to serve the locals appropriately. So one of the dilemmas we had was, how do we create a neutral third-party entity who can combine data from all the Blues in one database so that we can learn and improve healthcare? We can understand, and this is claims data, by the way. So every time you go to a physician office, a claim is incurred on your account. We know. What was the diagnosis? What was the claim? If you go get a prescription filled, a claim is incurred. If you go to the hospital, ER, anything, there's a claim. So what it gives you is a longitudinal view of patients. It tells you over the 7-8 years journey, or 10 or 15, what is happening? How did your health get worse? what are preventive things you can do, just like, Richard talked about it. So you've got to look at the entirety of a patient experience. So what we did in the Blue system was we consolidated data for over 100 million American lives out of 300, and this was de-identified. Because the point of this data was not to identify who is sick and what to do with this. It's privacy, it's your data. But the point was to how do we learn from that data? How do we go into this data? And it goes back 10 years. How do we see what has worked over the years and what has not worked? And just like JoAnn said, how do we figure out what to predict based on past behavior of 100 million lives? And these are all working adults under 65. And what is your pattern? And so that was sort of the foundation and the beginning of the journey. What we try to do is there way, we all talk about how much healthcare costs, right? And we all talk about where we're spending money in the wrong places and why. So what this kind of data enables us to do at BHI is to mine this and see, number one, where is waste in the system? We're spending a lot of money on care that we don't need to spend. And actually, we end up harming the patient. It's called low-value care. Right. So if you have an uncomplicated headache and somebody does a CT scan, that headache would go away in 8 weeks. And you're doing a CT scan and you're spending the money. Or if you're going and getting a colonoscopy in a hospital instead of a freestanding ambulatory surgical center, 4% of our healthcare spend is on things like different incorrect sites of service where you could get cheaper care, but you as a consumer don't know because your insurance covers it. Right. So this is sort of the dilemma we live in. So how do we understand these kind of things that you as a consumer may not know because there's no transparency? And how do we then go to the insurance companies or the providers and help them set policy with informed decision-making with data? How do we enable this data and make it transparent for you as a consumer to better understand your health? How do you get ahead of your diseases? Or what are things you should be doing? And make it transparent to you. How do we simplify all this? That's the journey we're on. And obviously, it doesn't stop at just claims. We're looking at social determinants of health. For example, we're doing all kinds of predictions, mining this data to see who's going to hit 250,000 in healthcare spend a year. There's a lot of people. With all the specialty pharmacy, all these new drugs coming, it's becoming the norm. And our thought is, but I was just talking to Richard before this, it's like, that's good, you need to know that. That's a cost approach to healthcare, but we need to care about the care of healthcare. Wouldn't you want to know who's perfectly healthy today, but will really become high cost, but not only cost, their health will decline tremendously? We can use this data to make those predictions. But then that's not enough. So my scientists all run off, all excited. How do we get better R-square sensitivity? And I'm like, pause. That's good that you predict who's going to be high cost, but isn't it important to say, what should you do with? Are they in a socially depressed area where they don't have access to healthcare and providers? Wouldn't you want to know? Or do you want to know that are they going into hospital for certain care that they shouldn't? Or, they have certain conditions and lab results that a claims wouldn't capture. So how do we integrate the data from hospitals, from providers, from your socioeconomic zip code to this claims experience, which gives you a longitudinal view of a patient? Now we're looking at you holistically without your identity, de-identify, and we can make informed decisions. We can look at predictive analytics. We can look at sites of service. We can look at low-value care. How much are we providing? Because we can go create policy saying, you know what? If you find somebody who's coming in for uncomplicated headache or low back pain and is getting a CT scan, maybe you should recommend to that person to, get some alternative physical therapy or just wait or get pain med. Things like that. There's so many alternatives that we don't explore sometimes. And that's what we're hoping to inform the different constituents in healthcare, be it a provider, be it a consumer, or be it a payer. That how do we think more intelligently about what we're doing and what policies we're setting.
Mm-hmm. And JoAnn, you've been in the data space for a while. Mm-hmm. How do you think the methods of leveraging data have changed, and Where do you see that going as you look forward?
Yeah, so I'm listening to Swati and I'm listening to Richard. And so before I was the data officer for Mastercard, I was the privacy officer. And so I can't help thinking about, we've used words so far like de-identified data, anonymized data. And I think that that's part of one of the issues about being responsible data stewards. And both of my colleagues on the panel use those phrases. And I think that that's one of the things that responsible organizations are really trying to up the ante on. And we're talking about it now as corporate data responsibility, because if you want to have sustainable data practices, whether you're talking about just data analytics or as we move into more sophisticated techniques like AI, that's really important as everybody moves forward in using data responsibly for the future of analysis. And so when I'm listening to Swati speak, there's analogies in financial services as well, that there's volumes of information that many companies have collected to do different analysis. But unless an individual understands the benefit of the bargain and understands the value that's being created on their behalf, and that the information that's been provided makes sense in context, right? So when I talk about security, when I talk about fraud, when I talk about economic analysis, when I talk about economic analysis that might be used for financial inclusion, usually those uses of data make sense in a financial context for Mastercard. When Swati is talking about claims information being used, in the way she's talking about it, I think most Blue Cross Blue Shield patients would be okay knowing that their personal information was stripped out. But they'd be very interested, I think, in both Richard and Swati's examples of understanding how that would then be applied to them and what decisions would be made about them, right? I think everybody in the audience is thinking, okay, I'm all for my hypertension, my back pain, my headaches going away, but how is that judgment going to be made about me? And I think that's part of the future of data analytics, and I think it's the future of data ethics, right? We hear about the words ethics in artificial intelligence a lot. We hear about that we need to be careful about bias. Well, one of the challenges of doing the analytics on de-identified and aggregated information is that we have to be careful that we don't let the bias in the data, whether that's sampling bias, reporting bias, implicit bias, in the information itself, dictate the outcomes, right? That our past learnings begin to kind of put us into a rigid output. So we have to look at both the data going in, the algorithmic processes that we're using, as well as look at the model outcome to make sure that we don't have the drift that actually has the model relearning the biases we're trying to pull out as humans, right? We all understand this as data scientists, right? And so it's really, we're at a really interesting, I think, inflection point. The first generation, we were all using real data. Now we have to worry about data quality. We have to look at accuracy. We have to look for fake data, right? We have to look at data lineage. We have to look for diversity in information to make sure that information and analysis is more inclusive of all different aspects of an analysis and a population that we're examining. And then we have to look at the outcomes. And are the outcomes really fair, and are they unbiased? All of these things are really important. Swati talked about transparency. How do we tell good stories simply so that our users, our customers, our individuals understand this, right? So how are organizations being responsible, not just in their privacy and security practices, but in the transparency and how they explain things, that their analysis is fair, right? That data is being used that's fit for purpose. These are all the trends that I think we have to begin to focus on as ethical data stewards. And no matter whether it's financial, whether it's transportation, media from the survey, or healthcare, I think all of this is going to be really important.
Yeah, and if I may add to that, the other thing, like I typically like to think about the analytics we do. You have the data. That's table stakes. You have to have data. It's expensive to consolidate data, but it is. Then you have to have insights. And then you got to make them actionable. And so when we have our de-identified data set and we run these predictions and these algorithms that we train on large volumes, we create cohorts saying, okay, this is diabetic with hypertension, this age, and why did one person become really sick and the other stayed healthy? What is the difference? How do we create prescriptive analytics? We do it with de-identified data. But then part of the journey doesn't stop there. then it's like, how do you make it actionable? So we would go back to the insurance company or the provider and say, let us tell you, when you have this profile and we predict that this member is going to, or this patient is going to get sicker or not, this person, let's apply it to your real data. So you can actually reach out to a Swati Abbott and saying, you know what, you have this, why don't you come into the office? We would like to change your prescription, or we would like to get this done or something. So make it personal ultimately. So you see the benefit of all that translated.
But I think it's important that
Right.
Swati has had some control
Right.
over this.
Right.
Swati knows what's going on
Right.
before she gets that call.
Right, exactly.
That's
and how do you communicate through a provider or something like that? It's a one-on-one. It's not just an insurance company throwing it over the fence at you. You know, so how do we make this personal? Now you go to a provider. I'll add another, like we were talking about.
this morning.
You give a provider that kind of information, the first thing they're going to say is, I don't agree. How do you tell me? And that's where the link between action and analytics fails. And so one of the things we were talking is, they're being reasonable. They've gone and they learn, you know, they know medicine, they understand. So you have to be transparent, not only of the data, but also the methodology. They want to understand, so why did you think this is happening? Explain. And you have to be able to say, you know, this is how we can explain, and this is the specific. Then you get buy-in. And those are the things that we frequently overlook. We're so down the AI path, or we're going to analyze data and apply the latest methodology or technology. But it's also, at the end of the day, the more complex our technology is, we've got to figure out, then how do we take that and translate it into something that is transparent so that the people who are consuming it know?
Well, Swati, as we talked about this
Yeah.
morning, I think one of the things we recognize that we all agreed on was often people get the data, they didn't ask the right question.
Right.
And so I find that so often when I hear people say, well, yeah, I'm into AI now, you know, we're doing them, and they have all the buzzwords. And I say, well, what problem are you trying to solve? And when you look at the data they're getting, you say, well, that's not going to solve your problem, you know? And so often there's a disconnect between the connection, and then as you pointed out, often there's that bias, as JoAnn has said, that I see it often. And the challenge there, of course, is that when they get the truth based on the methodology that has been used, based on science, often then they want to reject it because, well, that's not the way it is. As I said, you know what, every doctor's the best doctor, every practitioner's the best one. Complications are acts of God. It's not because we made a mistake or made a bad decision. But the data doesn't lie. So I think that in our infancy in this whole area, there's a lot of education that needs to be done so that people understand, you know, what the specific data is, what questions should I ask, how do I get that data, how is it aggregated, and then how does it bring value? How does it bring value financially, economically, the margins, and to the patient, of course, you know, that triple aim.
Mm-hmm. And as Tom mentioned earlier, because we have such a brain trust in this room, we really would like to get your thoughts on this topic. And so our second survey question is, in which areas will big data have the most impact on management? And the multiple choice options are employee surveillance, which is funny, drive efficiency, enhance transparency, and reduce middle management, those poor middle managers. Okay, and let's look at what you guys think.
Transparency, yeah.
Mm-hmm.
Yeah.
Looks like enhanced transparency.
Well, yeah.
Yeah,
And efficiency, yeah.
I would say so. That's very interesting.
Yeah.
That is interesting.
It would be interesting to sort of know whether you mean transparency in terms of within an organization or you know, what I think about as a reporter, public transparency, perhaps not.
Transparency in decision making.
Yeah.
Perhaps.
I mean, I'll give you, I'm sorry to interrupt,
Oh,
but
no.
I have a fantastic example. There was this large national employer, really large employer in the US. They came to us, and I was in that meeting, and they said, you know, we think that the problem with healthcare is, and again, this goes to your point, Richard, you know, just creating a hypothesis. We think the problem in healthcare and the cost and quality issue is that you have bad providers. If we eliminate the bottom 5% providers, we will see increased outcomes and lower costs. So I walked into that meeting. I said, I'm not going to have an argument on this topic. Let me look at your data. So I talked to them. I said, so let me tell you, and tell me if you agree. Your top spend is pregnancies, deliveries. Okay, fine. Your second largest spend is joint replacements. Yeah. Okay. I said, let's look at knee replacement. And let me show you where your bottom 5% providers, how much will you save over the next 3 years. You just have 48 surgeries in knee replacement in the bottom 5% providers. You're going to save $500,000 out of your over $1 billion spend? Exciting? Okay, let's flip the view. I said, okay, what if you went to the top 10% of the providers nationwide? What if you steered to the top 10%? You save probably in the range of $500 million, just as one employer. I said, is that now making sense? But now you've got a cost you incur because you're traveling and selling people all over the country. Somebody living in Maryland may have to go to Cleveland Clinic or what have you. They come back, their doctor doesn't know what happened to them. So there's a disconnect in care. So my thought was, okay, let's pick the best in your local area. And you save the same amount, and you have the personalized care, and that totally shifted the conversation. Mm-hmm. That's transparency in a different way. It's not a consumer transparency in decision making. And so that's also, I think, not to be overlooked.
Yeah, and I think the importance is, as we spoke earlier, was selecting those appropriate metrics as to what is value. Mm-hmm. 10 docs are going to give you different answers. What is quality? Same thing. And so being able to prospectively make sure that everybody understands what those endpoints are and how the metrics were derived, and then to Swati's point, then driving the business in that direction based on the data.
Right. Mm-hmm. And making it understood. I think that's what that poll really reflects, that everyone wants to understand what's going on. That efficiency is good, because that was the second response, but that understanding what's going on is really what people want to see from the data.
Yeah. Mm-hmm. And JoAnn, that'll have to be the last word.
Oh, okay.
Thank you so much for taking the time, and thank you for being a great audience.